so much, Doctor, for joining us. He is the former WHO World Health Organization and lead advisor, medical committee and quality at Redcliffe Labs. आज उनसे हम जानेंगे about TB elimination. इंडिया में कितनी प्रोग्रेस हो चुकी है about in eliminating TB और हम as a community, as a society क्या कर सकते हैं TB को eliminate करने के लिए. आपके अगर कोई सवाल हो, आपको कुछ जानना हो, तो आप चैट जो हमारा कमेंट सेक्शन है उसमें आप कमेंट्स कीजिए and Dr. Ashok Rattan will happily take those questions up and answer. Thank you so much, Doctor, for joining us. And today we will be understanding more about TB and how India is trying to eliminate it from you.
Thank you.
So, Doctor, before we start off, delve deep into understanding about TB, हम TB celebrate करते हैं 24th of March को. I remember the other day discussing and talking to you कि क्यों इस दिन को choose किया गया है TB को celebrate करने के लिए. अगर आज ये आप हमारे audience के साथ share करें तो it will be really nice.
Okay, TB जो है ये बहुत पुरानी बीमारी है. ये ममीज की जो बोन्स मिली हैं 9,000 years बैक की, उसमें भी टीबी का एविडेंस मिला है. Even Hippocrates, who is considered as the father of medicine, he thought that TB, क्योंकि ये फैमिली में होता था, तो he thought it was a hereditary disease. In 1882, Robert Koch, who was a general physician in Göttingen in Germany, he came to Berlin, which was the capital of Germany, and met Professor Virchow, who was the professor of pathology, to explain to him that TB is not a hereditary disease, but a bacterial disease. But Virchow did not tolerate him, and he felt that he was not, it didn't make sense. So on the 24th of March in 1882, Robert Koch spoke to the physiologist of Berlin and explained that he got a bacteria from persons suffering from TB. He injected into many animals and recovered the same bacteria. So he is convinced that this is a bacterial disease. Thereafter, because it grew like it grows like fungus in liquid culture, तो इसलिए mycology, fungus का नाम mycology है, तो इसलिए myco add कर दिया. But ये bacteria है, तो it became mycobacteria. So the name of this bacteria is mycobacteria, and because it produces tubercles, which can be seen by naked eye, it is known as tuberculosis, Mycobacterium tuberculosis. 1882 में there were two scientists, Zeal and Nelson. उन्होंने देखा कि it was very difficult to stain the bacteria. Bacteria जो Mycobacterium tuberculosis है, उसको स्टेन करना बहुत डिफिकल्ट है. मगर एक बार आपने स्टेन कर दिया तो उसमें एसिड लगाने से भी कलर बाहर नहीं निकलेगा, इसलिए इसको बोला एसिड फास्ट बेसिलाई. दैट इज व्हाई दिस बैक्टीरिया इज आल्सो नोन एज एसिड फास्ट बेसिलाई, AFB, एंड द स्टेनिंग इज नोन एज AFB स्टेनिंग. दैट इज स्मीयर माइक्रोस्कोपी में AFB स्टेनिंग देखते हैं, जो रेड स्टेन को रिटेन करता है और बाकी स्टेन को काउंटर स्टेन लगा देते हैं, ब्लू लगाते हैं या वायलेट लगाते हैं, तो उसमें ग्रीन लगेगा या ब्लू लगेगा, मगर उसमें रेड आपको आराम से दिख जाएगा. सो ये 1882 में ये डिस्कवरी हुआ. फिर रॉबर्ट कॉक को 1905 में नोबेल प्राइज दे दिया इसके लिए.
Oh, and that is why 24th को हम TB डे सेलिब्रेट करते हैं. मतलब ये बहुत इंटरेस्टिंग है कि किस तरह से हमारे जो साइंटिस्ट हैं, they work, they labor, they do this research and find out कि किस तरह से ये डिजीज क्यों हो रहा है, कहाँ से, whether it's a bacteria, it's a virus, क्या हो रहा है. और मतलब हम जो वर्क जो पीछे चल रहा होता है हमें पता ही नहीं होता है. इट इज आई थिंक द लेबर, द हार्ड वर्क ऑफ पीपल दैट गोज इन, दीज साइंटिस्ट दैट गोज इन, दैट हैज हेल्प्ड अस कम अप विद नॉलेज, प्रॉपर नॉलेज, अवेयरनेस एंड सॉल्यूशंस. एंड अ लॉट ऑफ ऑडियंस they have joined us. And डॉक्टर, हम आपसे जानना चाहेंगे कि जो टीबी, अगर किसी को टीबी होता है, पहली बात तो किस तरह से होता है? मतलब अगर मैं किसी को अगर टीबी है तो कैसे उसे
टीबी
पता
के
चलेगा कि उसे
दो
टीबी
रूट्स
है?
हैं. टीबी के दो रूट्स हैं. एक तो है कि ये लंग में इफेक्ट करता है. लंग में इफेक्ट करने से दैट मीन्स अपने सांसों में बैक्टीरिया आएगा. तो जैसे कोविड का हुआ, थ्रू द एयर इट विल बी ट्रांसमिटेड टू अनदर पर्सन. तो अगर एक तो एयर से जा सकता है, दूसरा है कि ये फूड में भी ये मिल्क में जा सकता है. अगर एनिमल्स में इन्फेक्शन है, स्पेशली काउज में. मगर इंडिया में क्योंकि मिल्क को पीने से पहले हम बॉईल करते हैं हमेशा, तो बॉईल करने से बैक्टीरिया मर जाएगा. तो इसलिए अगर आप बॉइल्ड मिल्क हमेशा ही लेते हैं, एंड दैट इज व्हाई rest of the world started using pasteurization. But this information was known to our foremothers rather than forefathers many centuries ago. And it is a normal tradition that we will boil the milk before eating,
Yes.
before drinking. So if we boil the milk and drink, then chances of infection through drinking milk is gone. Our main infection is through the air. उसमें जब इन्फेक्शन होगा, पहले जैसे 3 बैक्टीरिया जो हैं, अगर 3 बैक्टीरिया को हमने इनहेल कर लिया तो उसमें इन्फेक्शन हो जाएगा. इन्फेक्शन को डिजीज में कन्वर्ट करने के लिए टाइम लगता है. तो स्टेजेस जैसे हैं कि पहले एक्सपोजर हुआ. एक्सपोजर क्लोज कांटेक्ट से होता है क्योंकि एयर से होगा. तो अगर हमारे घर में कोई टीबी का पेशेंट है तो हमारे को इन्फेक्शन हो सकता है. अगर हमारे ड्राइवर को इन्फेक्शन है तो उसकी कार में बिकॉज एयर कंडीशन कार है तो उसमें क्लोज इन्वायरमेंट में इन्फेक्शन हो जाएगा. या बस ड्राइवर को है, या मेड सर्वेंट को है, या टीचर को है, या इंडियंस को ज्यादा इन्फेक्शन होते हैं बिकॉज आवर पॉपुलेशन इज हाई and we are in close contact. In other places, as you go, there are very few persons, और वो दूर दूर रहते हैं तो इसलिए उनको ज्यादा एक्सपोजर नहीं मिलता है. मगर जब पहले इन्फेक्शन होगा, इन्फेक्शन लंग्स में होगा. लंग्स में एक नोड्यूल बनाता है, उसको बोलते हैं गॉन्स फोकस. तो एक फोकस रहेगा लिम्फ नोड. लंग्स में जो लिम्फ नोड है, हाइलर लिम्फ नोड्स, वो स्वेलिंग हो जाती है. उसके बाद देन इट बिकम्स, इनिशियली वी यूज्ड टू कॉल दैट एज लेटेंट ट्यूबरक्लोसिस, क्योंकि उसके बाद कोई साइन नहीं होगा. इन दैट पेशेंट इज नॉट डिजीज्ड, इट इज नॉट इन्फेक्शियस. बट आफ्टर सम टाइम, एक तो है कि बच्चों में अगर होगा तो विद इन 90 days और सो इट कैन प्रोग्रेस टू डिजीज. एडल्ट्स में इन्फेक्शन होने के बाद नॉर्मली इट इज क्वाइट, सो इट इज नोन एज लेटेंट ट्यूबरक्लोसिस. मगर अगर आपको एस्मा है और उसके लिए आपने स्टीरॉइड्स लिए, या रूमेटॉइड आर्थराइटिस है उसके लिए आपने TNF अल्फा लिया, या ट्रांसप्लांट कराया, या इम्यूनोसप्रेशन कोई लिया, या HIV हो गया, तो उसमें डॉर्मेंट बैक्टीरिया एक्टिव हो जाता है. सो then it gets reactivated. So whenever our immunity decreases, tuberculosis reappears. And that is the adult type of tuberculosis, which affects the lungs. But tuberculosis can affect any parts of the body. So it can affect every part of the body. Primary infection is in the lungs. Lungs के बाद वो ब्रेन में जा सकता है. वो swallow करेंगे तो स्टमक, इंटेस्टाइन को भी इन्फेक्ट कर सकता है. उसके बाद इट कैन गो टू द किडनीज, इट कैन गो टू द जेनिटल ट्रैक्ट एंड कॉज इनफर्टिलिटी, एंड इट कैन गो टू द बोन्स. बोन्स में collapse कर देते हैं, उसमें spine को भी infect कर सकता है. So TB is a disease which used to be thought about for everything initially.
एक्चुअली हम यही रिलेट करते हैं कि टीबी मतलब लंग्स के साथ ही है, वो सांस लेते हैं, जिसको खांसी है मतलब उसी को टीबी है. आई थिंक दैट्स अ मिथ कि
जो
खांसी
पहले सिम्टम्स होंगे, वो पहले होगा कि यू वुड हैव इवनिंग राइज ऑफ फीवर. फीवर ज्यादा नहीं होता है, मगर इवनिंग में फीवर होगा, नाइट स्वेट्स होंगे, कफ होगा और लॉस ऑफ वेट होगा. अगर ये 4 चीजें होंगी और दिस परसिस्ट फॉर लॉन्ग, सो टीबी इज अ क्रॉनिक डिजीज. इट इज नॉट एन एक्यूट वायरल डिजीज, इट्स अ क्रॉनिक डिजीज. जब हम लोग स्टूडेंट्स थे तो हमारे को 3 हफ्ते बोला जाता था. आजकल थोड़ा जल्दी एक्टिव करना चाहते हैं, तो दे फील कि अगर 2 हफ्ते से आपको फीवर है, आपको इवनिंग राइज ऑफ टेम्परेचर है, इवनिंग स्वेट है, नाइट स्वेट्स हैं, लॉस ऑफ वेट है और कफ है, तो आप यू शुड सस्पेक्ट दैट यू माइट हैव ट्यूबरक्लोसिस एंड गेट योरसेल्फ टेस्टेड. आजकल एक नया मेथड निकला है which is एक्सरे, डिजिटल एक्सरे ऑफ द लंग्स. डिजिटल एक्सरे को फिर कंप्यूटर एडेड डिटेक्शन करते हैं, उसमें वो हॉट स्पॉट्स देखते हैं. एंड I've been told that whenever they have used this system, even persons who do not have cough, fever, evening rise or loss of weight, they also seem to have hot spots. So that means they are also infected. So infection in India is very common, and it is spreading because unless we diagnose this quickly in the community, it's not getting cured.
And I think बहुत लोग हैं जिन्हें ये symptoms, like I know, like I have a friend who was continuously getting fever, but उसे पता ही नहीं था. She was thinking कि ये viral है, ऐसे होता रहता है, हाँ ठीक हो जाएगा. But बहुत लेटर स्टेज में जब चीजें कॉम्प्लिकेट होने लगी, जब वो मूव नहीं कर पा रही थी, एंड जब उनकी हालत और बिगड़ने लगी, जैसे उनकी एपेटाइट भी लूज होने लगी, तब हमने जब उनका टेस्ट कराया तब हमें पता चला कि इट वाज टीबी. तो ये जो सिम्टम्स आपने बोले हैं, फीवर आना, आई कैन रिलेट कि हाँ इन द इनिशियल डेज वहां पे शी वाज कंटिन्यूअसली गेटिंग फीवर, बट हमें लग रहा था हाँ वायरल है, चेंज ऑफ वेदर है, और हम निग्लेक्ट करते रहते हैं सिम्टम्स को.
थ्रेशोल्ड आपको रखना चाहिए 2 वीक्स कि जो वायरल फीवर है वो नॉर्मली दे आर शॉर्ट लिव्ड. 1 हफ्ते में आप ठीक हो जाते हैं, बट 1 हफ्ते से ज्यादा 2 हफ्ते हो जाएं, so then you should not neglect anything, whether you are having cough for 2 weeks or you are having fever for 2 weeks or you are having night sweats or you are losing weight without wanting to lose weight. See, if you are going on a diet, then you don't have to run and suspect tuberculosis. But if you are not making any attempt to lose weight and you're losing weight, especially in children, then that is the time to get investigation done, and that investigation normally involves sputum examination. Sputum examination में रॉबर्ट कॉक ने तो smear examination किया था, and 1882 में smear examination was very good, but in 2025 sputum examination करना is then doing a crime, because it needs 10,000 bacteria to be present before you can detect that the person has infection. By the time it becomes 10,000 bacteria, that means the person has suffered for more than 6 months without being diagnosed. And in that 6 months, he would have already infected about, this is a guesstimate of course, he would have infected 25 persons or so in the society. So अगर उसको आपने डिटेक्ट करके ट्रीटमेंट भी दे दिया, तो सोसाइटी में तो उसने स्प्रेड कर दिया, उसने अपना कंट्रीब्यूशन कर दिया है before it is detected. That means that method, which was in 1882 the most appropriate, is the most inappropriate method to be used. And what is required is you should use a molecular method. Molecular method will give you results in 2 hours time. It will have detection power of 130 bacteria or so. 131 bacteria it will detect, and results are available in 2 hours time. Along with that, it will tell you whether there is rifampicin resistant or not. This has been available since 2011, or Government of India does this test free of cost.
Okay.
So there it is free of cost, and through CHAI, which is Clinton Foundation initiative, private labs have been given the cartridges at subsidized rates, with the promise that they will charge only a limited amount of overhead over that, and so that good services could be available in both private and in the government setup. In the government setup, it is free of cost, but yes, because government is normally overloaded with samples, so it is delayed. While in private setups, it costs a little bit of money, but the results are available the next day, so that the treatment can be started within days of getting infection and getting disease, so that before spread can occur, you can start treating the person. And once the person is on treatment, he becomes non-infectious.
In fact, doctor, I have seen that medicines भी अक्सर हमारे ये जो government bodies बनी हुई हैं, वो free of cost medicines भी देती हैं patients को,
हाँ जी,
ताकि
उसमें
and वो track
ऐसा
भी
है,
maintain करती हैं.
Government of India then initially they kept saying that there are missing millions, and it's because only the government labs were reporting. Then they made a software known as Nikshe.
Okay.
And they had a gazette notification saying that everybody who treats tuberculosis must enter the biometrics into Nikshe portal, inform what is the basis on inform about the patient and about the reason why you suspect that this is TB. Then the patient will get money, because they noticed that nutrition or malnutrition would make TB very severe. As a consequence, it was decided that everybody who has tuberculosis would get 500 rupees per month. And since the treatment is for 6 months, 500 rupees per month for 6 months will be transferred directly onto his account. For that, we need the information about Aadhaar card. And sometimes I feel that the patient is reluctant in sharing Aadhaar card, but उसमें हमारे को जो private labs हैं, उनको निक्शे में डालना होता है, so that the CMO of the district where he stays, the patient's name, the patient's phone number, the patient's address, patient's Aadhaar card, this is required to be input, so that the CMO, the Chief Medical Officer of the district where the patient stays, can get in touch with him, and the direct transfer of money can be done into his account. He would also then get free medicines for the duration of the treatment besides the money, and he would also, the doctor who sends this, the treating physician will also get the money for informing that the patient is under his care, and also informing when the treatment is complete.
Oh, that's such a nice initiative कि मतलब लोगों को nutrition नहीं मिल रहा है, उसीलिए ये चीजें complicate हो रही है, तो आप the government is paying both the doctor and the patient so that they are alert, they put in the efforts to address the issue, and that's such a wonderful.
And this has been expanded then as Pradhan Mantri Nikshay Mitra, so that private persons who wants to donate or who want to adapt the patients can do so and give additional support. But this much support is given to everybody by the government. See, it's a societal disease. And many more things are required, and the society and the community has to take active part if we are going to eradicate the disease.
मुझे याद है मैं आपसे बात ही कर रही थी लास्ट वीक जब हम मिले थे तो मैं आपसे बात कर रही थी तब आपने ये बताया था कि टीबी को एलिमिनेट इसलिए मत कीजिए कि आप बीमार पड़ रहे हैं, बट इसलिए भी जरूरी है एलिमिनेट करना क्योंकि आपके आसपास जो लोग हैं वो भी बीमार पड़ रहे हैं आपके कारण से. जस्ट यू आर नॉट सेविंग योर लाइफ बट मिलियंस ऑफ लाइव्स अराउंड. So I think that is important.
It is there that normal thinking is that poor persons get disease. It is not a disease of the poor persons alone.
True.
Infection has occurred in the rich and the famous even now. Even in very rich persons have died or have suffered from infection. Infection, maybe disease is more severe in the malnutrition, as I told you, or in those who stay in close environment, because actually we should start the moment we find that in the society there is one patient, then there should be contact tracing. क्योंकि जो उसके contact होंगे before the diagnosis is made within the family, that should be tested, because it's been noticed that children, about 200,000 children in the world died, and most of them were below 5 years of age, and 96% of them were never suspected to be having tuberculosis. But children are highly susceptible to tuberculosis, and if there's an adult with tuberculosis in the house, then they would get infection, and infection will move to disease, and disease can lead to death within 90 days. So that means we have a small window, a narrow window to intervene, to make the diagnosis and put the patient, put the child onto the correct treatment.
Absolutely, very true, very true. So, doctor, what has been the main achievements of National TB Elimination Program in making a progress towards eliminating TB from India?
So, what had happened is that in 2015, the world, the WHO decided that we cannot control tuberculosis by doing piecemeal kind of thing. So they suggested a strategy known on 3 pillars. And these pillars are then in 2015, a strategy was rolled out, which was known as Stop TB strategy. One was that it should do the right diagnosis and it should be patient-centered, etc. Second one was that it should have political support. Political support means there should also be financial support, and we should take bold decisions, not incremental decisions, because control was not working. So if we do the same strategies as we were doing during the control time, there is no way that is going to be eliminated. And third was that that means the society must invest into R&D and discover new innovative methods, and that should be, when they're discovered, they should be rapidly integrated into routine work, so that it should not be just only paper publications or patent grants, but if it is evaluated, and it should be then put into practice in a routine day-to-day activity, so that the cycle of improvement will occur. This started in 2015. So they made guidelines for what needs to be done by 2020, what should be achieved, by 2025, what needs to be achieved, by 2030, what needs to be achieved, and by 2035, what needs to be achieved. We need to be sure that it is elimination of tuberculosis does not mean eradication of tuberculosis. Elimination of tuberculosis, the aim of elimination of tuberculosis is that from whatever was present in 1995, by 2020, we should have decreased the deaths by 35%. By 2025, we should have decreased the death by 75%. By 2030, by 95%. And by 2035, by 95%. The incidence need to decrease from 2015 incidence. That means incidence would be how many cases per 100,000 population. It should decrease by 20% by 2020. By 2025, it should be 50%, then 80% by 2030, and by 2035, 90%. So these were the two major objectives about deaths and incidents, and that no family should add catastrophic cost effect of this. And on that basis, everything for tuberculosis is done free of cost to the patient, so that that objective has already been achieved, that there is no death occurring. Now, the incidence when we started in 2015 in India was 237 per 100,000. The incidence now is 195 per 100,000. But it was planned that it should be 55. So from though the incidence has decreased by 17%, which is double the rate of rest of the world, except for South Africa, which has decreased the incidence by 50%. So South Africa has been highly successful, while we have been second with 17.5% or 17.7%, which is double that of the rest of the world as 8.3%.
And so, compared to the kind of population we have, achieving that is actually a good number.
Yes. I think overall it's a great achievement. Even when we celebrate this TB Day, World TB Day, WHO says we should stress on three things. One is commit. Second is support. The third is act. So commitment by the politicians is 100%. As you've seen, the President of India, the Prime Minister of India, and all the ministers have been putting their efforts and spending time. Even recently, there was an innovation exhibition where various editions and movements were seen, and people from Niti Aayog are giving personal attention. So the political commitment is 100%. Then there should be financial support. Finances are also available. Finances are available. There were times when things were not available. Now everything is available. There's no money to waste, but everything is available. What is lacking is the activity. Most of the action, some of the persons who are working on TB, they are not convinced that the steps that have been recommended should be implemented. So that implementation is patchy. And I think more monitoring, severe monitoring is required. It has been suggested that actually, if you have staff which have recovered from tuberculosis, if you have staff whose families have been affected by tuberculosis, and if you employ them in TB eradication program, they will be more motivated. Somehow, in our case, it is more, job is a job, and whether they like it or not, they are posted in a place. And so you don't see the motivation that is required, the passion that is required to eradicate in the healthcare worker. I have not been able to see.
True, very true. So जो ऑडियंस हमारे साथ जुड़ी हुई है, अगर आपको कुछ जानना है टीबी के बारे में, अगर कुछ भी है आपके मन में सवाल है या कुछ भी ऐसी परेशानी है related to your health. And if you want to know, आप अपने comment section में डालिए, post कीजिए. Dr. Rattan is with us. He'll take up those questions. Dr. Rattan, अगर हम diagnostics की बात करें, how is diagnosis or these diagnostic centers contributing towards helping TB patients or towards the elimination of TB? And how early diagnosis can save lives of TB patients?
See, diagnosis plays the most critical part. And for centuries, we are used to sitting in our rooms and for patients to come with symptoms. And then we start first the clinical diagnosis and then the laboratory diagnosis. Now, a clinical diagnosis is possible and maybe required in some cases, but if you want to be evidence-based, it should be laboratory-based diagnosis. And we have the methodology which can detect even one bacteria if it is present. Unfortunately, it is not used. First thing is that this passive diagnosis is not going to work. This is what failed during control phase and will definitely fail during elimination phase. You need to go and do active case finding. Case finding would begin by doing contact tracing. The moment there is a case in the society, all his contacts should be examined. So we can work either from, we can start with the case or we can find out infected persons. But both need to be done. And this is something which has not even started in many of the places. So if you leave the person to become sick, really sick, to come to the hospital, then and he smear and you use smear, which we used 80% of times we use smear. In fact, one of the achievements which have been written is that we have done 1.83 crores smear microscopy. In 2011, WHO had recommended that the initial tests to be used for diagnosis should be molecular. This was repeated again in 2021. In fact, and in the repeat recommendations, they have written in as many words that the initial test must be a rapid molecular test recommended by the WHO and not smear microscopy or culture. If we do not follow it, see, excuses are there are 101 excuses. But if you don't do if you don't have the right starting point, how are you going to reach the end earlier than everybody else?
True. डॉक्टर अगर हम बात करें कि टीबी एलिमिनेशन की as a public health problem in India, so what are the chances of getting it eliminated?
See, as I said, that they had made the indicators, and when you look at the indicators that we should have been at 55 per 100,000, we are at 195. So that at this moment, in 2025, it is not possible. In 2030, if we do not take our foot off the pedal and keep pressing and be sincere, then they could, and change, modify the mistakes that we have been making of not adopting the right methods, not adopting the new treatment schedules and taking time in doing that, we should be able to be in a much healthier position by 2030. And they have suggested that maybe we should have different, we should group ourselves into 4 different types of countries. One is those where it's more than 100, where the prevalence is more than 100 per 100,000 population, which we share then. We share this with Indonesia and Nigeria, where the prevalence is more than 100, and this will be high TB countries. So here more efforts are required. We have 27% of the world's disease. So we have 27% of the world's disease. Then we have others which are in stage 2, and then which has between 30 to 100. Then there are others like Japan, Turkey, Mexico, which are between 10 and 29, and Europe, Germany, USA, they are about 10, and there are some places like Greenland which is less than 1. When you are less than 1 per 100,000, you need to go to less than 1 per million. Then you can say you have eradicated tuberculosis. But it's a long way to go, because we are 195 at the moment, and we need to go to at least less than 10 per 100,000, and that might be achievable by 2035, if not by 2030, realistically.
डॉक्टर, ये कौन से ऐसे hurdles आ रहे हैं that is like making things difficult for NTEP?
See, uh, hurdles are mostly in selecting the method. One, of course, as you know, that India has 27% of the disease burden, and the population would take many of the countries you can put inside. So the solution would be to identify each state as a country, and try to make that, rather than dilute our efforts, we must concentrate on what is achievable first, and by using the right methods. Active tuberculosis would be one method. Involving the private sector is another solutions. Then making sure that the community participation is also there, and making the diagnosis and linking it with a cascade of care, so that once the person is diagnosed or suspected to be tuberculosis, we have contact tracing, we get the x-rays done, we get the CAT done. If it is positive, then he gets the cascade done, and by the next day he is on treatment. So instead of taking weeks, which it is doing at the moment, we should take days in initiation of the treatment. Then we should follow up that at the end of 6 months, we should see whether so counseling should take place. We should make the people aware that this is 100% treatable and curable disease. So there's no, and anybody can get it. Anybody who breathes can get infected. So there's no stigma attached as a consequence of this. It's not because of some bad act that a person has done, but the consequence of being in a crowded place. And then support the person, because naturally when a person is immunocompromised or is malnutritioned, then his earning capacity decreases. As you have seen, Government of India already makes everything free available, and Prime Minister has also indicated that we should have mitras. So Nikshay mitras are supporting the persons. So the persons who are in the society need support, and hopefully we would be able to quickly detect, put the person on treatment. We also hope that a vaccine would be soon available. If a vaccine becomes available, that will speed up the elimination of tuberculosis.
Yeah. I think it was a wonderful session with you. We would end the session, and we had a lot of audience join in, and there were, I think, a lot of topics that we covered, we discussed, and areas that were addressed in the session. What is that last message you would like to give before we end the session?
My message would be that instead of incremental movement, we have to jump and we have to have disruptive activity. And I think more and more persons who were former TB patients and who have recovered, they should get into the bandwagon and help in eliminating tuberculosis. We need to move those persons who don't have buy-in or who don't have skin in the game out of this activity and get only motivated persons to implement, because there's great political support, there's financial commitment is available. What is lacking is the fire in the belly of the healthcare workers to deliver on the ground. So the act part is what we need to focus on.
I think action is very, very important. It's time to act. And as we celebrate TB Awareness Day on 24th of March, it's very important that we take the pledge that we will spread awareness and take necessary measures to eliminate it. As a community, only when we come together, we can eliminate it. And it's us only who can make a difference in the society. Thank you so much, dear audience, and thank you so much, dear doctor, for joining us and for the insights that you shared with us. So it was a great session, a very insightful session on how TB can be eliminated, what is the progress made, and also the symptoms and the care that is given to our people, especially in India. So it was a great, great, great session. Thank you so much. Bye, dear audience, and thank you so much for joining us.
Thank you.